This is a fantastic comment, and it perfectly highlights one key principle of what we call pain neuroscience education. And that key principle is that prior to getting to talk with a patient about how the brain and how the nervous system are involved in pain and how we can increase or decrease sensitivities to pain, before we do any of that, the first thing we have to do is clear red flags. So any healthcare provider should have the training to be able to hone in on specific descriptions and run specific testing to make sure that red flags are not present. For example, if someone is talking about tremendously excruciating pain in the middle of a bone, and it doesn't necessarily show patterns of muscular irritation or things like that, but the pain is excruciating, the pattern is hard to find, instead of brushing that off as something under the category of pain neuroscience, we may have to refer out for that patient to have imaging on that area to rule out some of those big scary things like cancer. But after those things have been adequately ruled out, you then have to move on and be able to treat that pain if it's still there. And that's what I mean. So, for example, let's run through the scenario where someone comes in with extremely uncomfortable back pain. It's impairing their ability to move. And you send that person for an MRI, but maybe there's nothing there. Or maybe the stuff that's there is not significant. There's a little arthritis and maybe some degenerative disc disease, but it's not to the level that we need to address with surgery or physical intervention. Those are the people that you've got to understand the science of pain and how the nervous system works in order to treat well. Because otherwise, they will have a clean MRI or two clean MRIs, and they'll continue to look for pain without answer. They'll continue to suffer unnecessarily because we've been unable to get into this other area. So I do thank you for that comment, because I think it's an important thing to point out every once in a while, that pain science is not putting the idea that pain is in people's mind and doesn't exist. It's exactly opposite of that. It's ruling out different causes before then settling on the pain sensitization and the treatment approach that accompanies it.